Good evening, everyone. My name is Miguel Perales. I'm the chief of the Adult Bone Marrow Transplant Program at Memorial Sloan Kettering, and it's my honor to welcome you this evening on behalf of myself, Dr. Jj Bullins, the chief of the Pediatric Bone Marrow Transplant Program, and of all the members of the team who provide excellent care to all of our patients here at MSK. This is our second virtual meeting as a result of the COVID pandemic, and obviously it's a very different evening compared to previous events. As you well know, this is really one of the highlights of the year for us when we get to see you and your family members and your friends and really see how you're thriving. And I very much look forward to this event in 2022, where we definitely plan to go back in person. I think we have learned some lessons from the hybrid events, and what we will probably do next year is have also a hybrid option, because I realize that many of our patients actually live out of state. And one of the feedbacks we got from last year is that this was also an opportunity for them to come to the meeting without traveling. So I wanted to give you a quick highlight of some of the things that we're doing on the adult service, and then I'll hand it over to Dr. Bullins. So really at the core of the work that we do are two main issues. One is we want to increase access, and the second is we want to improve outcomes for our patients. And there are two different areas in where we can increase access. The most obvious one is that for every patient in need of a stem cell transplant, we are able in 2021 to find a donor. And that can be a family member, that can be a matched volunteer donor from the registry, it can also be cord blood, or it can be a mismatched donor or haploidentical donor. And this has been really our mission, is to provide donors for everyone. The other important aspect in terms of access is also reaching out to where the patients are. And as you can see on the right, we're really trying to expand the care that we provide to our patients, not just in the city, but also in our regional network. We formed an alliance with Hartford Healthcare Alliance, as well as Lehigh Valley, so that we can provide care to patients in Connecticut and Pennsylvania. And we're also expanding our outreach into Westchester and Northern New Jersey, as well as Long Island. And we will increase the number of transplant physicians in those areas as well, so that patients who live in those areas can actually see their local transplant doctor without having come into the city. And our mission is really to provide the best stem cell transplant and cellular therapies for the patients of today and tomorrow. And to highlight some of the areas of active research that we're focusing on, I've presented this slide. You can see that we're trying to develop new conditioning regimens where we have more precise dosing for patients based on their individual parameters. We've done tremendous work over the last decade in trying to understand how the microbiome affects transplant outcomes. And we are now doing studies where we actively try and manipulate the microbiome to improve results. As I mentioned, we want a donor for every patient, and we're working on finding the best donor for every patient. We continue to work on graft versus host disease, one of the main complications of transplant, and trying to decrease the impact of graft versus host and improve immune reconstitution after the transplant. We also have a large focus on reducing the side effects of the transplant, both in terms of what happens during the actual transplant short term, but also what happens long term in patients so that they have better quality of life. And finally, we have a major effort also on trying to reduce the risk of relapse, which remains one of the main issues that we also deal with after transplant. And there we're working both with drugs as well as with different cell therapies to try and handle and mitigate the risk of relapse. As you well know, it takes a village to take care of patients going through transplant or cell therapy. And this is a slide that we prepared a couple of years ago, where we identified over 400 people who work at MSK who are involved in transplant, and in some level or another actually touch the patient who is going through a stem cell transplant. A lot of this work that we do, and particularly the work that we do when it relates to research and developing new therapies, obviously benefits from donations. We have had major support from Cycle for Survival, and you're going to hear about that in a few minutes, as well as Fred's teams. But we also recognize the contributions that many other donors, including patients and their families and friends, have made to the service over the years, and that allow us to do critical research in order to improve these outcomes. And again, I want to welcome you to this evening. It's really my pleasure, and it's one of my favorite evenings of the year to be able to be here with you and I hope you enjoy the rest of the evening. And now I'd like to introduce Dr. Jj Bullins, who will talk about the pediatric service.
Thank you, Mikael, for your nice and kind introduction. And for me, this is also a really important meeting, and I'm really looking forward to meet you guys next year here in the city, or at least part of you guys. So it has now been about 3 years, over 3 years, that I came to MSK with a clear mission for the pediatric transplant program. First of all, I wanted to continue to, let's say, deliver the excellent patient care, but also to create the most innovative program in the nation and the world. And within this innovative center, I wanted to further improve mainly the survival chances, but also the quality of life, because a lot of BMT survivors, thrivers may still face some quality of life impacting things. So quality of life is also very important. And by applying a precision allotransplantation, we will get there. And let me share some slides with you about precision transplantation. So on this slide, I'm simply showing you the evolution to precision transplantation. And historically, one size must fit all BMT. So we gave same dosages, same grafts, everything to the patient. But then there was the realization phase that one size does not fit all. And actually, this has to do with drug dosing, with the donors, etc. So nowadays, we have a more individualized or tailored transplant. And that has absolutely and will absolutely impact the survival chances, but not only survival, let's say, chances, also the quality of life. And so I call it a precision project. So yes, the survivors go up. And when you look to the survival rates 10, 20 years ago, it's way higher. But there remains a need because there are still survivors, thrivers that face some quality of life impacting things. By better studying the drug exposures, and this is all in collaboration also with the adult program, because I consider us pretty integrated here at MSK, to better understand what the graft characteristics are. So what is really going into the patients, and monitoring the immune reconstitution, because we all know that immune reconstitution, having good immune reconstitution after transplant is impacting and is actually the main driver of the outcomes. And Dr. Perales also mentioned the microbiome. We have a huge history in studying that and relating that to the outcomes. So the ultimate goal, and obviously the ultimate goal ultimately will be 100% survival, but that will take years. And now I can mention to you and let you know that over the last 3 years, we were able to enroll 60 to 70% of the pediatric patients in trials that are having the aim to be preciser, having reduced toxicity and increased the efficacy. But talking about transplant in non-malignant diseases, in, let's say, pediatrics, we are also talking about life-threatening blood disorders, which are not cancer, but are life-threatening. So these are monogenetic diseases like sickle cell disease, beta thalassemia, but also immune deficiencies. And I'm sure there are also people in the crowd today who had a transplant for a PID. And nowadays we have access to gene therapy, gene editing, or fixing the diseased gene. So that's what I also call precision transplantation. So we take the stem cells, in short, from the individual that requires a fix of the gene. These stem cells are fixed in the lab, and after they are fixed, we can give these autologous stem cells back after a conditioning regimen. But the stem cells are fixed, and because it's autologous material, there's no risk on developing GVHD. So now we have here at MSK sickle cell disease trials open, and also in immune deficiency clinical trial. And we hope we are able to open a couple more of these gene therapy clinical trials. Remember, 50% of the pediatric there's patients that go to a transplant, now allo transplant, are having these kind of diseases. Again, I would like to thank, of course, because Dr. Perales already mentioned, it's a huge teamwork. It's the transplanters, it's the attendings, it's the administrators, etc. And it's the great collaboration with the adult program. So despite the COVID pandemic and the rapidly changing uncertain world we are, let's say, living in, we were able to further streamline the pediatric program. And when I'm talking about we are talking about, I mentioned already, attendings, PharmDs, clinical trial nurses, coordinators, APPs, fellows rotating in our program, nursing, and all the ancillary services that are also taking care of our patients. Really a big shout out to all of them. And I'm really confident that we are able to bring in more innovation, more patients, and most importantly, give these patients a better life perspective, which means higher survival and a better quality of life. Again, big kudos to everyone who is involved. And now it's a real pleasure to introduce to you Sami Stanley, who was transplanted many years ago, 10, 15, 20 years ago, here at MSK, and her doctors. This is a unique, let's say, panel interview discussion with Sami and Drs. Prokop, Bulat, and Dr. O'Reilly. All three very, very passionate doctors who were leading this program here at MSK for many decades. I'm really looking forward.
Good evening. I'm very pleased to introduce Samantha Stanley, who formerly got a transplant here at Memorial Sloan Kettering Cancer Center. And I'm also happy to introduce Dr. Fareed Bulat, whom most of you know, as well as Dr. Susan Prokop also. Now she's hailing from Boston, and the rest of us from down here in New York. So what we're going to do is basically just ask a few questions and open it up to Sami to expostulate as she sees fit. At the time you got this diagnosis of having an EBV lymphoma, you were in high school getting ready for college. And I suppose the question would really come at that particular time is, how was that for you, and what were you thinking about at that particular time? What were you worried about, and how do you overall cope with that?
Well, first of all, thank you so much for having me here. It was actually a very strange thing for me at 18. I had a whole future in front of me, all planned out. And when I went into the hospital, all I was thinking was, am I gonna be back in time for play rehearsal? And when I got the diagnosis, it was absolutely nowhere in the realm of where I thought it was going to go at the time.
Do you have a sense of why you or your folks chose Memorial?
We were referred there mainly because of you, Dr. O'Reilly. My treatment was, from what I knew, really experimental. I had common variable immune deficiency. So they knew that you had specialized in some treatments, bone marrow transplants that would be beneficial to my situations.
What do you remember about your first impressions of Memorial Sloan Kettering?
I remember it being very big and intimidating compared to the smaller New Jersey hospital that I was at. But I do remember feeling really safe when I got there. And I remember meeting Dr. O'Reilly and thinking he was a little scary at first. But then I realized he was really a teddy bear. And yeah, you, Dr. Prokop, you were feisty. I remember that. You were very feisty about the day-to-day and my treatment, and You really communicated with my mom.
You were pretty feisty yourself, Sam.
Huh? Oh,
You were
yeah.
pretty feisty yourself.
Yes, I know. I do remember getting amazing care from all of you, from the nursing staff, and I never questioned whether I was in good hands, and neither did my parents.
Do you remember any of the specifics of the treatments you got, or did it become sort of a blur?
Do you recall getting a decent amount of chemo in preparation for the bone marrow transplant, but also because the cancer had turned into leukemia at that point. Beyond that, I would say I was in a little bit of a fog.
Tell us a little bit about where you are now.
Now I am 35. I have a 10-year-old daughter. I am in the career of customer service and logistics, and my daughter's name is Madeline, and I was not supposed to be able to have kids, I was told, and she is. She's amazing.
So Sami, for your transplants, your donor was your HLA match, your matched sister, Rebecca. How did that bring you together? Any closer? Did it change your relationship with her? And what did you get to thank her for her gift of life?
It definitely did bring us closer together. And in a way, it made me appreciate her more. I mean, I thank her probably at least once a year when it comes around my anniversary of my transplant.
And just for the record, you know that both of you guys have the same DNA right now in your blood.
Yeah, that's really cool.
Anything else you'd like to say to, other people who might be facing a transplant or things like that?
I would say whatever precautions that the doctors tell you to take, you take them. Because at that point, having no immune system, there is nothing worth the risk.
I thought that one of the advices you're going to give to other patients is be feisty, no?
Be feisty.
There you go.
Yeah, keep your fight.
Yep.
So I'd like to thank Sami in particular because of the fact she's got good insights. She's always been a pretty keen observer. She knew how to pluck our last nerve, and we probably knew how to pluck hers as well. Get her all sorts of aggravated. I'd like to also thank Susan. I didn't realize this, Sami, but you were her first patient when she was a fellow with us, doing all sorts of transplants. So this was, you were a key player in that regard. And then my good friend, Dr. Bullins, he just keeps going and keeps doing his thing. But thank you very much. It was wonderful.
It was great seeing all you guys.
Hi, everyone. That was a great video. Thanks, Sami, and thanks Fareed, Rich, and Susan for filming that. And I think now we're going to move on to one of my patients who I think may also acknowledge the fact that she may be a little bit feisty, as you'll hear about. It's really my pleasure to introduce one of the adult patients who underwent a transplant 5 years ago and who is thriving, Kim Hoffman. And you'll hear a bit about her story and some of her adventures post-transplant. So hi, Kim, it's great to see you today, even though it's virtually. And I wanted to have a little conversation with you today about your journey, your experience through the transplant journey, and also obviously through your recovery. So why don't you tell me a little about, when you were first diagnosed, what that felt like, and the treatments that you went through leading up to the transplant?
Sure. So it was December 2012 when I came home from college for winter break. And for a little while, I had what I was convinced was like allergy-induced asthma. But the allergist was just, after all the testing, was like, I suggest you follow up with a pulmonologist. And just from a really quick exam and a chest x-ray, he said, I suspect you have lymphoma. And the rest kind of just sitting, in that chair in that moment is a little bit of a blur. My dad turned to him and he was like, if this was your daughter, where would you go? And he, without hesitation, said MSK. So it kind of just all happened really fast from there. It was a CAT scan, then it was a meeting with the thoracic surgeon who did the biopsy that concluded that it was Hodgkin's lymphoma. So I began the standard treatment protocol for Hodgkin's lymphoma, which was ABVD. So I did 6 rounds of that and it felt great. I feel like all my symptoms subsided. And then the PET scan that August, after I had completed those rounds of treatment, showed that there was just this stubborn tiny bit of disease that remained in my chest. So I unfortunately was not in remission as I had hoped and, thought I was based on how I was feeling. So couldn't go back to school, had to do, another medical withdrawal. I did the ice with Rituxan, essentially to prep me for an autologous stem cell transplant. I had that stem cell transplant in January of 2014. Things were looking good. I was feeling good. Again, thought that was that light at the end of the tunnel. Again, immediately after classes started, I felt something on my neck again. So unfortunately had relapsed following that transplant. And it was a few months after that, I think Dr. Perales, that I was then referred to you, where I think we realized that, the allogeneic stem cell transplant was inevitable at that point. The whole journey kind of felt like, one punch to the stomach after another. And so another punch came when the bone marrow registry couldn't find a perfect or close to perfect match. So Dr. Perales, that was when you had suggested a haplo transplant.
Yes, and one of the options we have is to use a donor who's related to the patient and who's only half matched. So we were able to use your mom as the donor. We collected her bone marrow and then gave it back to you. And we got you through the transplant. And as a result today, your bone marrow and your blood is actually the same as your mother's blood.
There are a lot of things that I do and say now where she's like, it's my cells, because like my mom went down to the OR to have her stem cells extracted. They were bagged, brought up, and that was like my new birthday. And we've been celebrating that day for the past 5 years ever since.
You've also given back a lot to MSK, and particularly with your work in Cycle for Survival. I've gotten to see you ride and talk a few times. So I think you and your team has raised now over $60,000 for Cycle over the years. So tell us a bit about the Cycle experience.
So I got involved with Cycle shortly after transplant. It was, a conversation with one of the social workers here at MSK. I was like, can I get on a bike and do this for 4 hours? And she had explained that, it's not only about that and, what the day was like and, what the movement was in terms of beating rare cancers and the funds, 100% of them going straight to research at MSK. And I was like, okay, sign me up. So yeah, I started in March of 2017. That was my first year. Now, we're about to head into my team's 6th year, and the power of just like knowing that I'm not alone in my journey and nobody who's going through a cancer diagnosis or cancer treatment is alone in their journey. It's just so inspirational, to be surrounded by a room full of people who, hope and want the same thing, which is, a cure for cancer and, better treatment options for rare cancers. And
it's exactly the same feeling for me too. If you think it's inspirational, you can't imagine how inspirational it is for us. I mean, that's what drives us too. I mean, for me, it's one of the highlights of the year is the Cycle for Survival season.
It is by far my favorite day of the year.
So you did something very special this year, I know, because this year you celebrated 5 years after your second transplant. And I think you had planned something that maybe your parents were not aware of. But
yeah, kind of, I guess you would call it like a bucket list item for me was skydiving. I told my parents I was heading out east to celebrate, with a day at the wineries, and called them from the ground after. My mom was and probably still is in a little bit of shock, but yeah, absolutely no regrets.
And Kim, now that you have 5 years behind you, what would you say if you met somebody who was just going through this now?
Well, so first, I would say go to MSK if they're not already there. And then I think, a brave face and a positive attitude really do go a long way, because you can't change your diagnosis, but you can change the way that you handle it and face it.
It's been a privilege to take care of you as it is of all our patients, but it's also been especially, fun to watch you recover and do some of the crazy stuff. So,
well, thank you. You know, you're our hero.
Thanks, Kim. Thanks, Miguel. What a great special interview. I really enjoyed it. We have really come from far, and it is fantastic to have more and more thrivers each year here in New York, now virtual, hopefully back here in New York next year. But there also remains a need, what I showed you earlier and what Miguel also showed you guys earlier. We haven't reached the 100% survival and a normal quality of life for all. But with the fantastic teams we have here at MSK, we are really coming closer and closer. With that, I would like to thank you all for virtually joining us to celebrate. A very special thank you to all the speakers and all the patient speakers. And I would also like to mention that there are still some giving opportunities online for you guys. And we can add the link in the chat, so you can just click it, because this is really important for all the research we do, also to get to the goal we have to get to a 100% survival and normal quality of life. So from here I will explain a little bit the breakout rooms, because I really hope you guys will all stay on. In just a moment, we are going to end this formal program and open some breakout rooms. Each of our, let's say, various guests here at this evening will be able to choose which breakout room or rooms to visit. So you can move from one room to another. And thrivers who have issues with this, go back to the main room. And there is someone who can assist you guys. So with this, I conclude also on behalf of Dr. Perales, the formal part of this meeting. And I hope to see you all back next year here in the city, hopefully an online event. Thank you so much and enjoy the rest of this evening.